Okay, let's get straight into it. This is the deep dive where we take your stack of sources, the articles, the research, your own notes, and we dive in headfirst to pull out the absolute essential knowledge, the surprising facts, and help you make sense of what's most important.
Exactly. We're here to sort of guide you through the material, cutting through the noise to highlight those crucial insights so you can get up to speed quickly and effectively.
And today, we're tackling a topic that's, well, absolutely critical for anyone working with animal health or involved in breeding programs: sperm abnormalities in dogs and cats.
hmm We've been digging into a key clinical guide and several focused excerpts on this specific issue.
So our mission for this deep dive is to clearly understand what these abnormalities are, why they happen, how profoundly they can impact fertility, and what options exist for diagnosis and treatment. We're going to pull out the most significant details, including some really fascinating differences you might not expect.
Yeah, like the fact that what's considered normal for a cat's sperm can be completely different, often, higher in abnormalities than what's standard for a dog, and some truly unexpected factors that can cause these problems too.
Okay, let's unpack this. First off, the basics. What exactly are we talking about when we say sperm abnormalities?
So the core term here is teratozotospermia. That
The-
basically just means there's a significant percentage of abnormally shaped sperm in a sample.
A significant percentage.
Right. And the sources we're looking at set a benchmark for dogs at equal to or greater than 40% abnormal forms.
40%. So 40% or more odd shapes can be a real problem, a red flag. And for dogs, that high percentage is a known cause of infertility. That seems pretty straightforward.
It does, but here's where one of those really crucial, sort of surprising differences comes in, and the sources definitely stress this. What's fascinating is that fertile cats can inherently have that same level equal to or greater than 40% spermatozoal abnormalities and still be completely fertile.
Wait, hang on. You're saying a percentage that spells trouble in a dog could be totally normal in a cat?
Exactly. Sometimes even up to 60% abnormal forms can be perfectly acceptable in a fertile tomcat.
Wow. Okay, that's a massive distinction right out of the gate. You really can't look at cat semen the same way you look at dog semen.
Not at all. It just highlights the need for species-specific standards. Now, the sources also classify these abnormalities based on when they occur. You've got primary defects and secondary defects.
Primary, meaning they happen right at the source, during sperm production in the testicle.
Correct. These defects arise during spermatogenesis. That's the process of sperm creation inside the testes. They often point to a more fundamental, maybe a more widespread issue with testicular function itself.
Okay. And secondary defects.
Those happen after the sperm are formed, either during their journey and storage in the epididymis, or sometimes even due to improper handling of the sample after it's collected. Generally, these are considered maybe less severe indicators than primary defects.
Gotcha. So primary defects often point to a deeper problem with the factory itself, the testicle. Let's visualize this. What does a normal sperm cell look like, and then how do these abnormalities actually show up?
Okay, so a normal sperm cell has three main parts:
Mm-hmm.
the head, the midpiece, and the tail. You can think of it like a tiny tadpole, or maybe even simpler. The package, the engine, and the propeller.
The package being the head, carrying the important stuff.
Yes. The head contains the nucleus with all the DNA, the genetic package, and also the acrosome. That's a cap-like structure with enzymes that are absolutely vital for penetrating the egg cell during fertilization.
Right. DNA delivery and the key to unlock the egg. Makes sense.
Then the midpiece connects the head to the tail. It's packed, absolutely packed with mitochondria, which are the powerhouses generating the energy for movement.
Ah, the engine room providing the power.
Exactly. And then the tail, or flagellum, is that long whip-like structure that provides the propulsion, the actual swimming motion, to get the sperm where it needs to go.
Package, engine, propeller. Got it. Now, you mentioned the normal parameters differ quite a bit. How does that break down?
Right. So for dogs, the guides we looked at suggest you really want a high percentage of morphologically normal sperm. Typically, you're aiming for greater than 70, maybe 80% as a guideline for good fertility potential.
Okay, 70, 80% normal for dogs.
But for cats, going back to that key insight, the sources consistently say that greater than 40 to 60% normal morphology can be perfectly acceptable for a fertile male.
So a normal percentage that would have you really worried in a dog might be completely fine, even good, in a cat. That definitely bears repeating.
It's probably the single most important species difference to really grasp from this material. Yeah. Now, when things do go wrong, abnormalities can show up in any of those parts: head, midpiece, or tail.
Let's start with the head then, the package. What goes wrong there?
Well, head defects usually indicate problems with the genetic material itself, or with the acrosome, the cap. You see issues with size heads that are too large, that's macrocephalic, or too small, microcephalic. Shapes can be wrong too, pariform, which is like pear-shaped, or tapered like a cone, or even amorphous, just lacking any defined shape.
They just look off.
Pretty much. You can also see duplicated heads or internal vacuoles, little holes or bubbles within the nucleus. Problems with the acrosome itself are common too. It might be missing or too small or just abnormally shaped. The sources also mention indentations, things called crater defects. Ultimately, any of these can compromise the sperm's ability to deliver the DNA correctly or penetrate the egg.
Right, compromises the whole mission. Okay, what about the engine room, the mid-piece?
Mid-piece defects tend to affect energy production and the structural integrity, which directly impacts motility, how well it swims. A common one is a retained cytoplasmic droplet. It's basically a little bit of leftover cellular material that didn't get shed properly during maturation.
A leftover bit?
Yeah. If it's near the head, it's called a proximal cytoplasmic droplet, or PCD.
And what does that tell us?
Well, PCDs often suggest immature sperm, or maybe sperm that moved too quickly through the epididymis. High numbers can sometimes indicate primary testicular issues, like stress or dysfunction.
Okay.
If the droplet is further down, near the tail end, that's a distal cytoplasmic droplet, or DCD. That's typically considered a secondary defect, usually less concerning if you only see a few.
So where that little leftover bit sits actually matters diagnostically.
It can, yeah. Other mid-piece issues include bending or angulation sharp bends, which critically affects the sperm's ability to move forward efficiently. You might also see abnormally thick or thin mid-pieces, or structural problems with the mitochondrial sheath that wraps around it.
Affects the power of the steering, essentially.
Yeah.
And finally, the tail, the propeller.
Tail defects primarily impact movement, as you'd expect. Coiled, bent, or folded tails are pretty common, and usually result in poor or totally absent motility. The sperm just can't swim right, or maybe spins in circles.
Just can't get anywhere.
Exactly. Other issues include tails that are too short or missing entirely, sometimes doubled, or multiple tails, or broken and detached tails.
And the sources specifically mention something called the DAG defect.
Yes, the DAG defect. That's a specific type where the tail is tightly coiled, often around the head. The sources highlight that this particular defect seems to be seen more commonly in cats, and it can actually be congenital, meaning they're born with it.
Interesting. Okay, that covers the sperm cell itself, piece by piece. But the sources also talk about other things you might find floating around in a semen sample, right?
Absolutely. A semen analysis isn't just about sperm shape. It's a look at the whole fluid environment. First, you distinguish between immotile sperm, they're alive but just not moving, and actually dead sperm. We often use vital stains for that.
Like the eosin nigrusin stain, where live cells push the dye out.
Precisely. That's a common one. You also look for agglutination, which is when sperm stick or clump together. This can happen with inflammation, or sometimes it might suggest an autoimmune response where the body's attacking the sperm. And then, crucially, you look for other cell types that shouldn't really be there in large numbers.
Like white blood cells. That sounds like inflammation.
Exactly. White blood cells, leukocytes, are a really crucial finding. When there are lots of them, it's often called pyospermia. Their presence strongly indicates inflammation or infection somewhere in the reproductive tract. Could be prostatitis, inflammation of the prostate, or orchitis, inflammation of the testicle.
Okay. What else?
Red blood cells that's called hemospermia suggest bleeding. Could be from trauma or lesions like prostatic cysts, maybe even tumors. You might also see some epithelial cells shed from the lining of the tract, and importantly, bacteria or fungi, which obviously point directly to an infection.
So finding these other cells gives you vital clues about potential underlying diseases, not just the sperm quality itself. Now, the big question, and often the frustrating one, why do these abnormalities happen? What's causing all this?
The causes. They're really wide-ranging. We can broadly categorize them into congenital or genetic issues, things they're born with and acquired problems, things that happen later.
Okay, congenital or genetic first. Something inherited or developed early.
Exactly. This could include things like primary ciliary dyskinesia. That's an inherited structural problem affecting the cilia, which impacts sperm motility, or testicular hypoplasia, where the testes just don't develop properly from the start. And then there's cryptorchidism.
The undescended testicle, the sources really emphasize that one, don't they?
They absolutely do. Because that undescended testicle is held up inside the body, it's at a higher temperature. And that heat causes significant damage to the delicate process of sperm production, spermatogenesis. So you get abnormal sperm, or often no sperm at all, from that testicle.
And the cancer risk.
And yeah, dramatically increased risk of testicular cancer in that retained testicle
Hmm.
later on. It's a real double whammy, fertility issues and cancer risk.
Makes sense.
The sources also point out something interesting in cats. Inbreeding in domestic cats can cause a surprisingly rapid and significant drop in the percentage of morphologically normal sperm, sometimes in just one generation.
Wow, that fast.
Apparently so. And certain breeds are sometimes noted as having potential predispositions or specific defects linked to genetic diseases, like Irish wolfhounds reportedly having lower overall semen quality sometimes, or specific defects linked to a metabolic disease called fucosidosis in English Springer Spaniels.
Okay, so that's the genetic or developmental side. What about things that happen later in life, the acquired causes?
This is a huge category. Problems can start right in the testes. The sources highlight orchitis or epididymitis, that's inflammation or infection of the testicle itself, or the epididymis, where sperm
Or
mature,
infection.
and they specifically flag Brucella canis in dogs as a major, really serious cause of severe semen quality issues, often leading to infertility.
Brucella canis. Yeah, that's one of those big ones you always have to think about and screen for in dogs.
Absolutely critical, and it have public health implications too. But perhaps the single most common acquired cause of generalized semen quality issues mentioned is testicular degeneration.
Degeneration, and what leads to that?
A whole host of things, but one of the biggest culprits highlighted is heat stress. This can be systemic, like from a high fever caused by any illness, or it can be local scrotal heat.
Local heat, like just being too warm down there?
Exactly. High environmental temperatures, sure, but also things like prolonged periods lying down, especially on warm surfaces. And some surprising ones like obesity, the extra fat, insulates the scrotum, or even tight bedding or blankets trapping heat around the area.
Okay, hold on. Obesity or blankets causing heat stress that damages sperm production. Those are definitely things you might not immediately think of, but the sources really make you stop and consider them.
They really do. And they just underscore how incredibly sensitive sperm production is to even relatively small temperature fluctuations. Other acquired causes of degeneration include direct trauma to the testes, just simple age-related decline, tumors, neoplasia developing in the testes, autoimmune responses where the body mistakenly attacks its own sperm.
Autoimmune, wow.
Yeah, or even compromise of the blood supply to the testes. Basically, anything that damages the testicular tissue over time can lead to degeneration.
Okay. What about issues after the sperm leave the testicle but before ejaculation?
Yep. Problems can definitely arise in the epididymis or the ducts the sperm travel through, things like epididymitis or obstructions caused by cysts or granulomas, little inflammatory nodules. The accessory sex glands can also be a source of trouble, particularly the prostate in dogs or the bulbourethral glands in cats.
Like a prostatic infection or enlargement?
Yes, exactly. Prostatitis, which is infection or inflammation of the prostate, or benign prostatic hyperplasia, BPH, that common enlargement in older intact dogs frequently leads to pyospermia, WBCs, hemospermia, RBCs, and it negatively impacts sperm motility and morphology because it affects the fluid environment and how sperm transit through.
And the animal's overall health must play a big role too.
A huge role. Any significant systemic illness, especially one causing a prolonged fever, can temporarily disrupt spermatogenesis. Endocrine imbalances, think hypothyroidism or Cushing's disease, severe organ disease, chronic debilitating conditions, or systemic infections like canine distemper or feline infectious peritonitis, FIP, or feline immunodeficiency virus, FIV. All these can negatively affect sperm quality. It's really all interconnected with the animal's overall well-being.
It really sounds like if the animal isn't healthy overall, its reproductive system is likely going to suffer too. What about things that we might inadvertently cause? Human factors.
Ah, yes, the iatrogenic or management-related causes. Certain medications are a significant factor here. The sources list things like corticosteroids, like prednisone, certain androgens, chemotherapy drugs, obviously, and even some antifungals like ketoconazole, especially at high doses or used long-term.
How do those drugs cause problems?
Well, some of them suppress the hormonal signals needed from the brain for sperm production. Others are directly toxic to the developing sperm cells within the testicle. So yeah, treatment for one condition could unfortunately impact fertility as a side effect.
Okay.
And critically, improper semen collection and handling. This is a really important and thankfully often preventable cause of apparent abnormalities.
You mean like temperature shock? Letting the sample get too cold or too hot?
Exactly that. exposing sperm to extreme temperatures, using lubricants that are toxic to sperm, using dirty collection equipment, or using improper semen extenders. All these can damage perfectly normal sperm after they've left the body, making them look abnormal under the microscope.
So handling is key.
Absolutely. The sources also mention the effects of sexual activity management. For instance, prolonged sexual abstinence can sometimes lead to an increase in certain abnormalities, particularly those proximal cytoplasmic droplets, often seen in the very first ejaculate collected after a long break.
Interesting. And the opposite. Too much activity.
Conversely, excessive overuse, like breeding multiple times a day for many days, could temporarily deplete sperm reserves and potentially impact quality, although quality might improve with appropriate sexual rest.
That is an incredibly comprehensive list of why things might go wrong. So how do all these different defects and underlying causes actually impact the animal's ability to reproduce? What's the direct link to infertility?
Well, they directly hinder the sperm's ability to actually get to and fertilize an egg. It's pretty logical when you break it down. Reduced motility from those mid-piece or tail defects means the sperm simply can't swim effectively towards the egg. They can't make the journey.
Right.
Abnormal morphology problems with the head shape or the acrosome means the sperm might not be able to penetrate the egg's outer layers, or even if it does get inside, it might carry damaged DNA, leading to fertilization failure or early embryonic death.
So the shape and the movement are literally stopping the process at different stages.
Precisely. Low sperm concentration, or low count, simply means there are fewer sperm available to even attempt the journey and overcome the natural barriers. Fewer tickets in the lottery, essentially.
Makes sense.
And the presence of those other cells we talked about, white blood cells, creating a hostile, inflammatory environment that can damage or kill sperm, bacteria potentially damaging the sperm or the seminal fluid, red blood cells altering the fluid composition, all these things further reduce the chance of successful fertilization. The sources also mention DNA fragmentation within the sperm head, which isn't something routinely tested in practice, but is known to be linked to lower embryo viability and increased pregnancy loss.
It all makes, well, chilling sense when you put it all together. If the components are faulty or the environment they're in is hostile, fertility is obviously going to suffer. So when you suspect a problem, how do you go about diagnosing exactly what's going on and, maybe more importantly, why it's happening?
Okay, the diagnostic process really starts with a thorough breeding soundness examination, or BSE. That involves getting a detailed history, health, medications, environment, past breeding performance, any changes. Then a complete physical exam, paying really close attention to the reproductive tract. You need to carefully palpate the testes for size, symmetry, consistency. Are they firm, soft, lumpy? And check for any signs of pain or swelling.
Checking if they feel normal, basically.
Exactly. Then comes semen collection. The method varies. Manual stimulation is common in dogs. Electroejaculation is sometimes used. But the sources really emphasize that cats almost always require chemical restraint or general anesthesia for semen collection, which is a really important practical difference.
Right, another factor to weigh up, especially for feline patients.
Definitely. And the absolute cornerstone of the diagnosis is the semen analysis itself. This is where you get down to the nitty-gritty. You evaluate the volume and the color of the ejaculate first. Then you assess motility.
How well they swim.
Right. Both the total percentage of moving sperm and, crucially, the progressive motility of that sperm moving forward in a purposeful, fairly straight line. Computer-assisted sperm analysis, or CASO systems, can provide more objective, detailed data here if available.
That sounds very precise, getting numbers on speed and direction.
It can be, yeah. You also measure sperm concentration, how many sperm cells are there per milliliter of semen. And then comes that crucial morphology evaluation we've been discussing at length. This involves preparing stain slides and carefully examining them under high-power microscopy.
And the sources seem to really stress getting the slide preparation right here.
They absolutely do, and it's critical. Because poor technique can create artifacts, things that look like defects, but are actually just damage caused during smearing or staining. Things like rapidly drying smears or using overheated slide warmers can cause issues. That's why examining a wet mount of fresh, unstained semen using phase contrast or DIC microscopy in addition to the stained slides is so important.
So you check the living sperm on a wet slide, too.
Exactly. It helps you confirm if things like bent or coiled tails are true defects present in the live, moving sperm, or if they might just be artifacts created during the staining process.
Got it. Compare stained and unstained.
Right. And you need to count a significant number of cells, typically 100 or even 200, on the stained slide to get a representative percentage of normal versus abnormal forms. You also assess viability, using those vital stains we mentioned, and carefully look for those other cells, WBCs, RBCs, bacteria, fungi. And absolutely critical in dogs presenting with semen abnormalities is testing for Brucella canis.
Right, back to Brucella. The source mentioned a screening test and then needing confirmation.
Yes. The rapid slide agglutination test, or SAT, is a common screening method. It's quick and easy. But because false positives can occur, any positive result on the screening test must be confirmed with more specific tests, like the agar gel immunodiffusion, AGID test, or bacterial culture of semen or blood.
Okay. What if the semen analysis shows a clear problem? Maybe lots of abnormal sperm or inflammatory cells, but you still don't know the underlying reason why.
That's when you move on to further diagnostics. Endocrine testing, checking hormone levels like thyroid or testosterone, can identify underlying hormonal imbalances. Imaging is often very helpful. Ultrasound of the testes and epididymis can reveal things like tumors, inflammation, cysts, fluid accumulation, or signs of degeneration.
See inside without surgery.
Exactly. Ultrasound of the prostate is vital in dogs with prostatic issues, and an ultrasound of the abdomen is needed if you suspect a retained testicle that you couldn't feel externally.
And if you really need to know what's happening right inside the testicular tissue itself, if you suspect the factory isn't working right.
That's where a testicular biopsy comes in. It's often the definitive diagnostic tool for cases of azoospermia, that's complete absence of sperm, or severe oligozoospermia, very low sperm count when you suspect a primary problem with sperm production within the testes itself. It can diagnose conditions like germ cell aplasia, lack of sperm-producing cells, or severe irreversible degeneration. Karyotyping, looking at the chromosomes, might also be done if a congenital or intersex condition is suspected.
Okay, that's a pretty thorough process to try and get to the bottom of it. Once you have a diagnosis, or at least a strong suspicion of the cause, what can actually be done? I mean, can you somehow fix sperm once it's already malformed?
Right. And here's another really key takeaway from the sources. There is generally no specific treatment to change the shape or fix the structure of sperm cells that are already abnormal.
Yeah.
The entire focus of treatment has to be on identifying and addressing the underlying cause that's leading to the production of those abnormal sperm.
Ah, okay. So you don't treat the bad sperm, you treat the problem that's causing the factory to produce bad sperm in the first place.
Precisely. That's the goal.
Yeah.
So if it's an infection like bacterial prostatitis or epididymitis, you use appropriate antibiotics, ideally guided by culture and sensitivity results. These might require fairly long courses, maybe 4 to 6 weeks or even longer, to penetrate the tissues effectively.
Right. What about Brucella canis specifically? Can that be treated?
Well, the sources state that while Brucella canis infection can be treated with specific long-term combination antibiotic protocols, it often leads to irreversible infertility in male dogs, even if the infection is cleared. And because of the serious zoonotic risk, the risk of spreading to humans and other public health concerns, the recommendation from many authorities is often euthanasia for affected dogs, particularly those intended for breeding.
Wow. That really underscores just how severe and serious that particular infection is.
It absolutely does.
Mm.
For other potentially reversible causes, treatment is targeted. If there's inflammation without infection, anti-inflammatories might be used while you address the underlying trigger. Critically, if heat stress is suspected...
You get rid of the heat source.
Exactly. Providing a cooler environment, ensuring the animal isn't lying on hot surfaces for long periods, managing exercise carefully to prevent overheating, clipping hair around the scrotum, or maybe even using scrotal cooling devices in specific situations, and addressing those other factors, like managing obesity.
Right. Getting rid of those surprising heat contributors like excess fat or blankets.
If a specific drug is implicated, discontinuing that medication is obviously key, although the time it takes for recovery, if it happens, depends a lot on the drug and how long it was used. Nutritional deficiencies, if identified, need correction through diet or supplements. Proper semen handling techniques must be implemented immediately if that was found to be an issue.
Okay.
For non-cancerous prostatic disease in dogs, treatments might include antibiotics for infection, procedures to drain cysts, or specific medications like finasteride to shrink and enlarge prostate, BPH. Or ultimately, castration can resolve BPH, but obviously ends the breeding career.
What about using hormones to try and stimulate things?
Hormonal treatments, like GnRH or HCG injections, are mentioned in the sources for some specific cases, like documented hypogonadism or low testosterone. But they really caution that these must be used carefully, under veterinary guidance and with close monitoring. Inappropriate use can actually sometimes suppress spermatogenesis further. Supplements like L-carnitine or L-tyrosine are also sometimes tried, thought to potentially support sperm metabolism or motility, but evidence varies.
And the sources mentioned something about maybe frequent collection helping temporarily in some cases where the cause isn't clear.
Yes, that's mentioned for some cases of idiopathic teratizospermia, meaning abnormal sperm where you can't find a specific cause. In some of those situations, increasing the frequency of ejaculation, maybe collecting semen every couple of days for a short period, might temporarily improve the quality seen in those ejaculates.
Why would that be?
The thinking is that it reduces the amount of time sperm spend sitting in storage in the epididymis, which might decrease the accumulation of certain secondary defects like those distal cytoplasmic droplets or detached heads that can occur during storage. But again, it's usually a temporary effect and doesn't fix an underlying primary testicular problem if one exists.
Okay, so those are the things you can potentially treat by addressing the cause. What about when the damage seems permanent, the irreversible causes?
Unfortunately, yeah, many causes do lead to irreversible damage. Severe testicular degeneration that's progressed to fibrosis or scarring of the tissue, congenital issues like germ cell aplasia where the sperm-producing cells were never there to begin with, or severe hypoplasia where the testes are just too underdeveloped. Extensive testicular atrophy where the testes have shrunk significantly and lost function. Permanent structural obstructions that can't be surgically fixed.
So some things just can't be fixed.
Sadly, yes. Severe cryptorchidism usually requires castration due to that high cancer risk, and those retained tests are typically non-functional for sperm production anyway, due to the heat damage. Expensive testicular cancer also typically requires castration. And autoimmune orchitis, where the immune system destroys the testicular tissue, often has a very poor prognosis for recovery of fertility. Some severe obstructions might also just not be surgically correctable.
That's a lot of potential outcomes. Now, if you do successfully treat a reversible cause, like an infection or removing a heat source, how long does it actually take to see if the treatment is working? When would you expect sperm quality to improve?
This time frame is probably one of the most critical pieces of information for the sources, especially for managing owner expectations. Spermatogenesis, that whole complex cycle of producing new sperm from the stem cells in the testes, maturing them, and getting them ready for ejaculation, takes approximately 60 to 90 days.
60 to 90 days, 2 to 3 months.
Exactly. In both dogs and cats.
Mm.
This means you will not see significant improvement in semen quality immediately after starting treatment or removing the insult. You just won't.
Ah, right. Because the sperm you're collecting today were actually produced weeks or even months ago before the treatment started.
Precisely. The sperm being ejaculated today started their journey 2 to 3 months back. So you need to wait for at least one full spermatogenic cycle, and ideally maybe even closer to 2 cycles, to pass for healthy new sperm, assuming the treatment worked to be produced, mature, and appear in the ejaculate. So a repeat semen evaluation should only really be performed after this 60 to 90-day period has elapsed, following the successful treatment or removal of the underlying cause.
That 60 to 90-day window is absolutely key then for managing hope and planning follow-up. So putting it all together, what's the overall prognosis for future fertility once these kinds of issues are found? Does it vary a lot?
It varies hugely. The prognosis is entirely dependent on the specific underlying cause, how severe the damage was when it was diagnosed, and how long the problem had been going on before any intervention started.
So an acute temporary issue that's caught early is obviously better than something chronic and severe.
It's exactly right. Generally, a good prognosis for return to acceptable fertility is associated with mild, acute, easily reversible causes. Things like a temporary fever that resolved quickly, simple semen handling errors that were corrected, or maybe a mild bacterial infection that responded rapidly and completely to the right antibiotics.
Okay. What about a more guarded prognosis, where it's less certain?
That's typically for more chronic conditions. Moderate to severe testicular degeneration, where the extent of permanent damage is uncertain. Some infections, like Brucella, often carry a guarded to poor prognosis for fertility, even if the infection itself is treated, just due to the potential for permanent damage. Or cases where the underlying cause remains unclear idiopathic or is only partially treatable.
And a poor prognosis. When is hope pretty much lost?
That's usually reserved for those congenital defects, causing a lack of germ cells, like aplasia, severe irreversible testicular atrophy or fibrosis, permanent structural obstructions that can't be bypassed, extensive untreatable testicular tumors, or severe autoimmune disease that has destroyed the functional tissue. In those cases, restoring fertility is unfortunately very unlikely.
This is incredibly detailed information and potentially complex or even difficult news for an owner or breeder to hear. What advice do the sources give on communicating all this effectively?
Client education is absolutely paramount throughout this whole process. It's vital to set realistic expectations right from the start. Explain clearly that diagnosing the specific cause can sometimes be complex, it might take multiple tests, and unfortunately, treatment isn't always successful in restoring fertility, even if a cause is found.
Manage expectations up front.
Definitely. And crucially, explain that 60 to 90-day biological time frame for potential recovery before you can reassess semen quality. Make sure they understand why you need to wait and when those repeat evaluations will actually be meaningful.
So they understand the biological reality and aren't getting discouraged or thinking the treatment failed after just a few weeks.
Precisely. If there's any suspicion of a genetic or inherited cause for the abnormality, then genetic counseling is essential. That involves advising against breeding that particular animal and potentially discussing the risks for close relatives depending on the suspected mode of
Yeah,
inheritance.
right. Responsible breeding advice.
Mhm. Provide prevention tips where applicable, really stress the importance of avoiding heat stress through proper environmental control, shade, cooling, and being careful with exercise or grooming, especially in hot weather. And emphasize good general breeding management practices, including pre-breeding screening, like testing for Brucella.
And being upfront about the potential costs involved, the diagnostics, the treatments.
Absolutely. Transparency about the potential financial investment is really important right from the beginning. And finally, if fertility ultimately cannot be restored, it's important to discuss the alternative options clearly and compassionately. This might include assisted reproductive techniques like artificial insemination, if some usable sperm are available, perhaps considering using other stud animals, or even looking at adoption if continuing a breeding program isn't a viable path forward for them.
That's really practical advice. Before we wrap up, any final specific notes or reminders that are particularly unique to cats that we should reiterate?
Yeah, just to quickly circle back on those key feline points from the sources. Remember, cats almost always need anesthesia or deep sedation for semen collection, which is different from most dogs and add the layer of consideration. Their naturally higher baseline percentage of abnormal sperm is normal. For the species, don't panic at 40% abnormal. Focus on the percentage of normal cells, where 40 to 60% can still be compatible with good fertility.
Right, judge them by their own standard.
Exactly. Be aware of potential breed predispositions that might exist, possible seasonal effects on semen quality in some environments, and how prolonged abstinence might affect their semen parameters slightly differently than in dogs. Sometimes short periods of abstinence, maybe just a few days, are recommended before attempting collection.
Got it. Well, this has been a really, really deep dive into what is clearly a complex but incredibly important topic in animal reproduction. We've unpacked the specific types of sperm abnormalities, explored that huge range of causes from genetics and heat stress to infections and management mistakes, really understood their direct impact on fertility, walked through the whole diagnostic process from exam to biopsy, and discussed what can and sometimes can't be done, including that critical 60 to 90-day time frame for seeing potential recovery.
You should now be equipped with the key knowledge points pulled directly from the sources we reviewed to be really well informed on this critical aspect of canine and feline reproduction. It touches on so many areas of animal health and management.
Absolutely. And reflecting on everything we've covered today, particularly thinking about that 60 to 90-day biological time frame, the 2 to 3 months needed for new sperm to be produced and mature after you address an underlying cause, what does that really reveal about the patients and perhaps the acceptance of biological realities that we absolutely must have when we're dealing with reproductive health challenges in animals? It's certainly not an instant fix, is it?